Now let's see if a patient presents with leukocytosis. How should we proceed? What is leukocytosis? It's actually a white cell count which is more than 11,000 per microliter. Now if we see there is leukocytosis, there is tissue infiltration or no infiltration. What is meant by tissue infiltration? Tissue infiltration is the phenomena in which the cells or the hormones or the chemicals, they are present in areas where they are not normally present, or if they are present in small amounts. In tissue infiltration, they are present in very large amounts. For example, white cells are normally present in bone marrow, but they are present in very large amounts in bone marrow, more than normal. This may be tissue infiltration. Similarly, the white cells are not present in the spleen in excess amounts. If they are present in very large amounts, this is tissue infiltration. So look for the presence of tissue infiltration, which can be seen in bone marrow, in the liver, in the spleen, in the lymph nodes. It can be seen in the skin, in the meninges, and in mucous membranes. We can easily see, for example, in the mucous membrane of the gums. So this type of leukocytosis, which has tissue infiltration, is usually the result of leukemic process. And then we see if there is no tissue infiltration, is not there, we see the peripheral film. If there is leftward shift or there is toxic granulation present or not. If this toxic granulation is not present, this is most likely a physiological leukocytosis which does not have clinical implications or clinical effects. This can be seen, for example, in stress. Stress can be both physical stress or psychological stress. An example of physical stress is that, for example, a patient has myocardial infarction. This is an aseptic infarction, but there is such a profound sympathetic response that the marginated pool of WBCs comes into circulation and there is high TLC. And then you can have leukocytosis in pregnancy, in smoking. Some of the drugs, for example, corticosteroids, can cause leukocytosis, and in patients who got splenectomy, there may be a rise in leukocyte count. Then if the slide shows that the patient's cells show presence of leftward shift and toxic granulation, which means the bone marrow is producing very young cells, maybe band cells or maybe even metamyelocytes, in response to the requirement of these cells in different parts of the body. So this is pathological. This may be seen as a consequence of infections, allergies, and inflammation. These are called leukemoid reactions. Now, how to differentiate a leukemoid reaction from leukemia is that important is that there is no tissue infiltration in leukemoid reaction, and second, the leukocyte alkaline phosphatase score is generally normal in patients who've got leukemoid reaction, when this is abnormal in patients who've got leukemic reaction. So this is how we proceed when you get a patient with leukocytosis.